Doctor, you mentioned before about the benefits that can be expected, specifically with respect to osteoarthritis of the knee. What are the benefits that the patients can see, and is it sort of guaranteed, or what sort of can taking painkillers be avoided? Once they undergo the treatment. Can you explain a bit about that?
Okay. So if you talk about the benefits, primarily people come to us with a few common issues that they want fixed. One is the pain.
Yeah.
Of course, the most top of the mind is the pain. Nobody wants to suffer pain. That is relatively a symptom which can be dealt with by other things. You give a painkiller, then they feel they are okay. But I'm saying from the conventional medicine, that's what is often done. So those who are not having surgery are generally put through painkillers.
Yeah.
But that can't be done for too long. Because painkillers cause a lot of harm. Regular use, even for a short duration, many painkillers produce gastric symptoms. So very often you are given an anti-ulcerant also to sort of cover up that. But even notwithstanding that, over a long period of time, most painkillers lead to renal problems. So they cannot be used for a very long period of time. That's where we step in. One of the very important things that happens with Ayurvedic treatment is that the level of pain that they undergo comes down dramatically without the need to take painkillers.
Okay. Yeah.
So very often when they come initially, they might be on some painkillers, but as they undergo our treatment, we sort of withdraw the painkillers and they are able to sustain very well with Ayurvedic treatment. Yes, occasionally on a day if they are straining themselves very much, they might get a pain and one day they may use a painkiller. But the need to regularly take painkillers is gone.
Okay.
The other thing is about mobility. They are not able to move. Very often there is a lot of stiffness, severe rigidity in the joint. All that is relieved very well. There's a lot of improvement in their gait. They are able to stand and walk much better after undergoing the course of treatment and with continuing medicines and all that. So the other one is swelling. In some cases there is a lot of swelling around the joint. So that can also be very well relieved with our treatment.
Okay.
So mostly patients come to us with these sort of functional disabilities. That they are not able to move around, they are not able to climb stairs, stuff like that, or even walk to the market and buy something and come. Some people even find it difficult to carry on with their daily activities like having a bath, going to the toilet independently. So these are difficulties. So these are things that we try and address very, very effectively. They are able to lead the normal sort of life. Yes, there would be an occasional pain when they strain themselves, but they don't feel curtailed. They can still lead a life with activity.
Okay.
So that is what we are achieving through our treatment. So if you summarize the main benefits, that's what it is.
Okay.
And as I said, in most cases, almost all cases, they stop taking painkillers regularly. An occasional painkiller when on a day if they strain too much or they are traveling for a long distance with their sitting in a particular posture, they develop slightly aggravated pain on that day, they can use a painkiller. We also don't discourage them from using a painkiller occasionally. But regular use of painkiller is generally not needed.
Okay.
Yes, they will have to continue some of our medicines and keep applying the oil. Even that, it's not that if they don't take it for a day, immediately they will get the pain.